Center for Lasik and Ophthalmology. How are you? Yeah, that's good. I'm glad you were able to make the late appointment with us. We understand that your schedule is very busy, and we always want to accommodate our patients to come in at the time that's most relaxing and convenient for them. Yeah. Alright, so I'm not really familiar with names, but I do remember your face. So, what's your name again? That's right. It's nice to see you again. Alright, well, give me a moment while I put up our computer screen. There. Okay, my friend. Just a couple questions, okay? So, preliminary. There we go. How long has it been since you stopped wearing contacts? Okay. Good. And, how long has it been since you stopped wearing creams, skincare, or maybe even makeup? Good. Any changes in your medical history? Good. And lastly, the most important question. Do you have someone to take you home? Good. Alright. That's great. Yeah, today's gonna be a good day. You're gonna see so much better than you ever imagined. Yep. Good. So we're gonna take you to another room to do a preliminary exam again. We're going to establish any differences in the baseline that we took last time. Okay. Alright. It's good to compare the baseline and today to make sure that it's as safe and perfect surgery as possible. So if you haven't noticed, that chair behind you has wheels on it, like last time. Yeah. So I'll help you sit down. Okay. So, we're going to wheel you to the next room. So just close your eyes for me and we'll take you there, okay? Alright. Just close your eyes. Good. Almost there. Okay, you can open your eyes now. Welcome to this room. So, in this room, we're going to take a couple tests, just like last time. Give me a moment to put on my gloves. We're going to test any aberrations in your eye. We're going to test corneal thickness, and we're going to dilate your pupils as well as other things, okay? So for this test, the room is going to get very dark, so don't be afraid. I'll be right here. Okay. Are you ready? Just look into the hole there. There's going to be a blue light. Good. Now, don't try so hard, but it's going to focus, okay? And there you go. Okay. That's good. So for that test, we wanted to do is to get your pupils into the right diameter. We need the pupil to be large enough for the laser to work. Yeah. Okay, my friend. Now we're going to do another one. So this one has a red light, and it's just gonna map out your corneal size, thickness, as well as check for any other things in your eye. So let's look into the hole. Just follow where it goes. You did great so far. Okay, so now that that's done, I just wait a little bit until we hear the results. Meanwhile, we can go ahead and sign some papers. So, are you able to read through the papers that we had mailed to you? Okay, that's good. Just because it's an elective procedure, we just want to make sure that you're informed of the realistic and non-realistic expectations, as well as the fact that it's elective, risks and benefits for you. Yeah. Okay. You ready to sign some papers? Okay. So here's a clipboard here. If you could sign this one, we just adjusted the light. It doesn't need to be too bright. Okay. Now, this one here just lets us know that you're aware of realistic and unrealistic expectations. Here you go. Okay. Right there. Okay. Good. And one last one. This one's saying you're gonna be great. All your signatures are different. Okay, great. Let's put this back. Alright. So I just got the results. Corneal thickness is perfect. Yeah, after stopping your contacts, it's better than before. That's good. Your pupils are dilated just properly. Okay. And no differences. Alright. It's always nice when everything works out. Yeah. Okay. So, we're going to take you to the prep room now. Are you ready? Alright. Just close your eyes for me. I'll take you there. Almost there. You can open your eyes. Welcome. Welcome to our pre-op room. So, we're almost there. Here, we're going to put a little cap over your hair. That way, none of your hairs are in the way of the procedure. You ready? Okay. Essentially, yes, it is definitely like a shower cap. But do not be confused. This is a very special shower cap. There you go. Now, we also have some for your feet, okay? Alright. Let me just put them on your feet. Great. So now, my friend, I want to show you a list of medications that you will take. It's in this medicine bag that we prepared for you. Okay? So let's show you what you have in here. It's just a little bag. Looks like so. Everything you need fits right in here. Now in this bag we have some lubricants. Now this you will wait to use till about 3 days after your surgery, okay? The first few you will be sleeping and tearing so much the wetting drops won't be necessary, but the tearing is normal. Alright. Now, another thing in your bag we have here are a list of medications. And this is a sample one for you. It might be hard to read, but basically, let's see if I move it closer. How's that? Okay. You have a chart of all the medicines you'll take. 3, 4, and 5. Starting tomorrow, while you're awake, I want you to take antibiotics, ofloxacin, and an anti-inflammatory, prednisolone. Along with that, you take another anti-inflammatory called ketorolac. And this will tell you how many days you need to take the medicines. These are eye drops that go in your eyes every 4 hours, while 10 days, 4 days, and this one will start on the 11th day every 6 hours. And finally, the refresh every 3 hours. Here you can check off the time that you administered the drops. It would be very helpful if you had someone help you with the application of these drops. Everything is in small concentrations, so don't worry about overdose. These products or medicines are for the success of your healing for this procedure. Yeah. And I trust that it's going to be very successful. You can always tell when someone's inner peace and inner faith will make the healing process and procedure very successful. So here's a couple drops. They come in boxes. We've labeled them for you. So this one is the dexamethasone. Okay? You want to take these. We've also given you some pain medication, but only when you need it. There's just a few in here. It may be too strong. If it is, then just take Tylenol or try to get a lot of sleep, which you'll have to the next few days anyway. Alright. Now, I want to tell you about how to wipe your face. So, you can always get a Kleenex. Okay. And you always want to wipe just below on your cheekbones. If you tear, if you get sweaty, touch your eyes, not at all. Your forehead. So, let me show you how close to your eye you can touch, okay? This on your cheekbones. Tearing will be normal. We want fingers away from the eyes to prevent infection. Just right there. And just right there. Good. Yeah. No contact sports for a few days, no makeup for a couple weeks, and no contact sports, strenuous exercise for 4 weeks. You can do non-contact sports in 3 days. That's what I mean. Now, the most important thing, my friend, when you're in the shower, you cannot wash your face for about 2 weeks. You cannot touch the eye, wash the eye. So, when you're in the shower, the water will be from behind, and you will just let the water touch your hair. You could even hold your hands here to keep water away from your face. Just like that. Just like that. If you don't have hair, that's great. It makes cleansing much easier. But you could also use some goggles, which we're giving you for your sleep. And they look like this. Okay. Like this. Yeah. Yeah. So, when you shower, you can wear it, but never face the water. Alright? I think someone's ready for their relaxing medicines. So, we give medicine to every patient to help them relax, help their eye muscles relax, most importantly, to make the procedure go very smoothly. Here you go. 1 Xanax and 1 eye relaxing medicine. Here is pill number 1. Good. And pill number 2. Okay, good. So, just close your eyes. I have some water here. You ready? Okay. Good. Alright, let's take that from you. Okay, so we're going to prep you for another room, and we're going to have you meet Doc, and after that she's going to have you lay down, have you demo a couple sounds, a couple sensations, so that you're prepared for the actual procedure. Okay, great. Alright, you ready? Okay, close your eyes. Almost there. Okay, you can open your eyes. Knock knock. Hi, I'm Dr. Shar. Nice to meet you. How are you feeling? So you relaxed from the medication? Good. Yeah, that's good. I want you to be relaxed. Alright, so we're gonna have you lay down, okay? And then I'm going to just clean your face, put on some tape, give you some sample sounds so you know what to expect, okay? Now, the prepping and the finishing of each eye is about 5 minutes. It's very fast. But the actual time we will actually be working on your eye is a matter of seconds. Yeah, seconds. So, whenever you're ready, just lay down, and then I will be right behind you and talking you through everything. Alright. Hello, my friend. Okay, so remember those sounds I told you we were gonna demo? So, the laser is really quick, and it's just gonna sound like some tapping, okay? So it's gonna sound like this. And then, you may even hear it over here, sounding like this. Good. It's just like that. Now, wow, that's happening. It might even sound something like this. And that's very normal. It's good. You're going to have a blinking red light, and it's just going to be right here. All I want you to do is stare. Stare at the blinking red light right here. Now we're going to numb your eye. This numbing drop will last long enough for the procedure and more. And if you decide that you want to stop, all you have to do is raise your hand and we'll stop. Here is a numbing drop. There you go. That's sure to get both eyes. Now, remember, there will be some slight pressure, especially when we put a speculum on, which looks like this. We're going to clamp like that. But after that, you'll feel just fine. Let's wipe your face and eyes. Things are gonna get blurry now, but that's absolutely normal. Things may even get a little darker for you, but again, that's absolutely normal. Let's go ahead and put on our mask. Great. Can I have my gloves? Thank you. Great. Let's go ahead and palpate the eye area. Great. Looks good. Muscles look good. Very relaxed. Good. Okay. Let's go ahead and start the procedure. Good. Let's go ahead and tape the eyes. Good. Other side. Good. Other side. Good. And other side. Good. Okay. Great. you okay? All of our hands here are healing hands. You're going to come out with a very successful procedure. A bit darker. Alright, speculum. Good. Okay. Initializing. Mapping. Good. Okay, one eye. And go. 25. 20. Stare at the blinking light. 15. 10. 0. Mapped. Beautiful. Opening. Beautiful. Beautiful. You're doing great. Go. 20. 15. 10. 5. 0. Okay, beautiful. Almost done, my friend. Close. Okay, good. Cover that eye. You're doing good. We're doing the other eye now. Alright. Map, initializing, and go. 25. 20. 15. 9. 5. 0. Good. Okay, let's see. Beautiful. Ready, go. 20. 15. 10. 5. 0. Some drops in there. Good. Okay. Alright, let's close that eye. Going to put some lights on. Take out the clamp. Okay, good. Okay. Okay. You did great. Good job. We're gonna sit you up. Hi. Welcome back. Can you read any of that? You can? Oh, that's good. Okay. Let's take your cap off. Yay. Alright, we have some glasses for you. There we go. Good. So remember, we have your bag of important medications. We want to see you back here tomorrow, okay? What's the earliest you can come in? Okay. So what we're going to do is we're going to take off these bandages. We're going to inspect your eyes, and then you can start wearing the not the contacts, but the sleeping glasses at night, okay? And you can start taking the drops after that. Oh my gosh, you can see. Okay, don't look too hard, but tell me if you can read it. Yeah? It's going to adjust after a first few days, even weeks, okay? So we're going to have you come in and check your eyes. Yay! Yay! Yeah, I'm so happy this worked out. So we'll see you next time. Alright. Call me if you have any questions, and we'll all be here to answer your questions, alright? Okay. Bye.